I'm Dr. Jeffrey Alexander from the Mayo Clinic, Rochester, Minnesota campus. I work in the Eosinophilic Esophagitis clinic along with my colleague David Katska and a group of allergists, dietitians, and esophageal nurses in the management of eosinophilic esophagitis. This is a disease that is defined by the presence of eosinophils, which are white blood cells in the lining of the esophagus. Really didn't know much about this disease and really didn't start looking for it routinely until maybe 2000. And it appears to be increasing in frequency significantly in our society over the past decade. Now, some of this is because the disease was there and we really didn't look for it. But I think clearly there's been an increase in incidence beyond that over the last decade, which has been seen with other allergic diseases as well. This is a disease that in children presents with a multitude of symptoms, but in adults it presents with primarily solid food sticking when they swallow, so-called dysphagia. These are people that notice when they eat bread, meat, dry rice, it sticks. They have to wash it down, sometimes even have to regurgitate or vomit up the food. And occasionally they end up in the emergency room having the piece of meat removed by medical professionals. The natural history of this disease is really uncertain. It appears that it persists long term. Generally persistent symptom is that of food sticking. Does not lead to cancer, does not lead to debilitating illness, does not spread to other organs. The etiology of this disease is associated with the eosinophil. The eosinophil is a type of white blood cell that's not normally in the esophagus. When it's in the esophagus, it does tend to produce proteins which can make the esophageal wall sticky and cause food to stick on the way down. These proteins can also cause scarring or fibrosis of the esophagus, which causes it to narrow down, and food may get stuck because of narrowing of the esophagus. In adults, some of these people do have gastroesophageal reflux disease as well. And we're very early in our understanding of this disease. I tell people we're in the second inning of this ball game. How is this diagnosed? It's diagnosed by doing an endoscopy, which is a scope test. Patients are sedated. A scope is passed down through their mouth into the esophagus, and biopsies are obtained. And then we look at these biopsies under the microscope and do find the eosinophils. Well, how do we treat this disease? First off, we use acid-blocking medications, which will work in about 30% of the patients. These drugs are safe to take long-term, and if they're an effective therapy, they're a great choice. However, the majority of the patients will not respond to the acid blockers, and then we have several options. The first of which is a topical steroid therapy. We've used topical steroids for asthma, for long-term treatment, and they are really associated with minimal side effects. They are almost universally effective at treating this disease, but do require long-term use to keep the disease away. Our next option is a food elimination diet. Taking the 6 most common allergic foods out of one's diet in early studies is about 70% effective in adults at relieving the eosinophilia and controlling their symptoms. A 6-food elimination diet, however, needs to be done under what we call endoscopic guidance, with endoscopies done to determine the response in the esophagus so we can best come up with which of those foods you're allergic to and if you respond at all. We can also dilate the esophagus with a stretcher tube at the time of endoscopy. That tends to relieve the scarring of the esophagus and can relieve swallowing symptoms quite effectively for up to 2 years in half the patients. However, this does not do anything for the underlying inflammation and the eosinophilia which will be present. Lastly is the role of maintenance therapy. Who needs to be treated long-term? This is an area of controversy, but this is a long-term disease, and we feel that patients with persistent symptoms or scarred down, narrowed esophaguses do require long-term maintenance therapy, which could either be a topical steroid, an acid blocker if they responded, or the 6-food elimination diet. Okay, in summary, this is a disease associated with food sticking in the esophagus. Eosinophilic esophagitis does require long-term treatment with physicians interested and knowledgeable in its management. I think we are uniquely situated for that at the Mayo Clinic with a multidisciplinary group, and we do have multiple ongoing clinical trials in the management of eosinophilic esophagitis. With long-term care, we can generally return almost all patients to eating an unlimited diet with minimal symptoms and prevent the long-term complications of scarring in the esophagus and food impaction in the esophagus. Thank you.